We really don't know what triggers a problem in a joint, except for a traumatic event that can cause a problem. But in general, as you age, there's nothing specific that can cause a problem in a joint unless you have a rheumatologic disorder that was diagnosed at any point in your lifetime. But as you age, your joints can degenerate, but it doesn't necessarily mean you will have pain in your joint. Having a degenerative joint does not mean it is not a functional or a painful joint. If you have a knee deformity or your hip can't move as well as it did 20 years ago, doesn't necessarily mean you have to have anything done for it. So unless you have pain or a large deformity, you probably shouldn't see a doctor. But if you do have pain or it impairs your ability to do activities of daily living, you should see a doctor about it. So if you have pain or do an exercise and you have pain afterwards, most of the time it's muscular pain. I think when that term, no pain, no gain, I think refers to muscles more than it does joints. If you have joint pain after you do an activity, you should probably stop doing that activity. If you're in the middle of an activity and you have pain in your knee or an ankle or even in your foot, you should probably stop doing that activity. I do see many patients that come in that will take an x-ray and we'll look at the x-ray, and a lot of the residents or medical students that come through will look at it and say, oh my gosh, that looks terrible. And you turn and ask the patient, how much pain are you having? And they'll say, I really don't have any pain. I was worried about my knee bowing a little bit more. So just because you have an x-ray that says degenerative arthrosis or arthritis in the joint doesn't necessarily mean there's something wrong with the joint in that it can't move appropriately or you even need to have a surgical procedure performed.